Ready to go? Good afternoon, everyone. Can you hear me?
Yes, you're good, BJ.
Right. Good afternoon, everyone. Thank you so much for joining us. My name is BJ Clark. I'm a board member here at Philabundance, and thank you for joining us for a special conversation about the recent White House Conference on Hunger, Nutrition, and Health. Very excited for everyone to join us, especially on this Friday afternoon. So many of you are so supportive of our cause, and I know all of us are going to join later this afternoon to support our other really good supporters, the Philadelphia Phillies, and root them on in the great work they've done for the organization. So know it's a Friday afternoon, know everyone's busy, holiday, some folks are off on Monday. So thanks for taking the time. We are here to talk about, really what was an extraordinary event recently at the White House, and an opportunity for Philabundance to directly participate with other advocates around the country and the most senior folks in federal government, including the president, which we were very fortunate to participate in, and as many of you know, have been so fortunate to have him visit us in the last 2 years. We're going to hear from a couple folks today, and then sort of do an informal panel discussion. Let me introduce you to our panelists. Loree Jones-Brown. Loree is the CEO of Philabundance. Many of you know her. She is a terrific advocate and a terrific leader for our organization. She's been with us right before the pandemic, and she survived that, and she's still smiling. And we're really excited and thankful for her leadership and grateful for everything she does for us. So you'll hear from Loree today. Desiree Marr-Murphy. Desiree is the founder and CEO of Murphy's Giving Market, a food bank located in Upper Darby. Desiree has an amazing story, which I cannot do justice to, so you'll hear it directly from her. But she was able to attend the conference. And then Barbie Izquierdo, the Director of Advocacy and Neighbor Engagement for Feeding America, and also the founder of Community Driven Consulting. Very excited to have all three of you to share with us your thoughts on the conference and how we take the words and deliver it into action. And the three of you, there's no better than the three of you than to tell us and to give us your thoughts on maybe how we do that. So with that, I'm going to throw it first to Loree.
Thank you so much. Thank you so much, BJ. BJ Clark is vice chair of the board of Philabundance. It's great to have BJ and such dedicated board members. I know we have a number of board members that are logging on. I believe the chat feature is functioning, and so feel free to let us know who you are in the chat, and then you can either use the chat function or the Q&A function later on to ask questions or to weigh in. It is indeed an honor to serve Philabundance, but also to join both Barbie and Desiree in DC last week for the White House Conference on Hunger, Nutrition, and Health, the first in 53 years. Congressman McGovern, who's been the champion of this for years, as I understand it, came to Philadelphia about a year and a half ago. And Desiree and I had the opportunity to meet with him then and talk about the work that we were doing. This was his roadshow, we think, that led up to him bringing other people in a bipartisan way to bring support for this, to have for the first time in these many decades, a focus on health, nutrition, and hunger. It definitely aligns with the work that we're doing here at Philabundance and at Feeding America. And so it was great for us to be able to be there. I will put in the chat a little bit later for folks. I think I'm going to ask folks to pull up my slides if they would. But we'll put in the chat for you the recording. There's a YouTube link for all the plenary sessions, and encourage you to take some time to watch them, to experience what we experience, really the power of people who care coming together, especially if you scroll toward the end. Encourage you to listen to Jose Andreas's, the famous international chef's, passionate call for us to really support, to really focus on food. Food is energy for this country, and support people in meaningful ways. So encourage you, if you need further inspiration after hearing from Barbie and Desiree, to check that out. One of the things he said is that this was really about harnessing the power of food. The future of the nation will depend on how we feed ourselves. I think that's a great way for my remarks to start. I'm going to give an overview of some of the policy recommendations that came out of this. But you see here the goal, how do we really come together to end hunger in America? And those of you close to Philabundance know that we've set ending hunger in our community as a goal for ourselves. This also is about increasing healthy eating and physical activity, and really setting a bold goal of doing this in the next 7 years. The pillars that you see before you, how are we improving food access and affordability? How do we ensure that we're integrating nutrition and health? Empowering, how do we empower the people we serve and consumers to have access to and make healthy choices? How do we support physical activity? And then how do we make sure that we are enhancing nutrition and food security research to ensure that the work that we're doing is having the right and positive impact? I'll ask you to go to the next slide. Yeah. We at Philabundance and our partners at Feeding America did a lot of work before September 28th, 2022. Really, since it was announced and really before, we've been engaging with our community members, people with lived expertise and experience directly. And I know Barbie will talk some about this in her role at Feeding America, but for us here on the ground, supported by Feeding America, we engage people across the Philadelphia region. We engage people who are food insecure, who receive our food, the pantries and partners we work with, our staff, through in-person and online gatherings to really collect ideas, thoughts, input, and then provide that through the Elevating Voices platform to the White House conference organizers. And so those ideas, information, suggestions, concerns were all submitted before the national strategy was developed. You go to the next slide, please. The national strategy, and we again will provide this as a link and then as a follow-up. On the eve of the conference, the White House released this national strategy on hunger, nutrition, and health. I'll walk through some of the themes that emerged from it. But this, what is striking about this, and you'll see, is that this covers multiple departments at the federal level, and signals an $8 billion, billion with a B, investment in this work over the next several years. And they're great pictures of Desiree at the conference and others, and you'll see that throughout. Here are the themes that emerged, I think, really for those of us in the greater Philadelphia area that were really important. First was really making it easier for people to access government benefits. You've heard how many people we serve, 130,000 people per week, up from 90,000 pre-COVID. You've heard about the amount of food that we distribute, up from 25 million pounds to 55 million pounds a year. But even with that, for us in this area and across the country, we know that even more people receive food through government benefits like the Supplemental Nutrition Assistance Program, or SNAP, formerly known as food stamps. And so for every meal that we're able to provide as a food bank with Feeding America, up to 9 or 10 are provided through those kinds of benefits. And so a key theme for us was that it was going to be easier for our neighbors to access government benefits. There was a call for the extension and return of the expanded child tax credit, and then making it easier for people to access not just SNAP, but the summer EBT program, making it easier for families over the course of the summer, as well as WIC. And then generally simplifying TFAP requirements. TFAP is known as the Emergency Food Assistance Program. It's a federal program that's administered by the state and then at the county level. Across the Commonwealth of Pennsylvania and the state of New Jersey, much of the government food that is distributed is through TFAP. At Philabundance, we distribute 2 types of TFAP food. One is called TFAP Bonus, but just this month we started splitting the TFAP county contract with the city of Philadelphia. And so making it easier for people to access those kinds of resources is critically important. The next is make it easier for people to get the healthy and culturally responsive food that they want. Pretty much everybody who registered knows us and knows that a few months ago, we made an additional commitment through our good food policy to provide more nutritious food to people, but also to provide more culturally responsive food to people. We have dramatically increased the variety of food that we're offering based on what we're hearing from our agency partners and people on the ground. And so this was a theme that came through the White House as well, noting that we need to support those farmers, those outlets for providing diverse food, but also making sure we're providing people with the healthy food that they want and deserve, and that is culturally responsive. Next is making it easier for healthcare to cover the cost of healthy food. And again, this is something that we've been working on here in the Delaware Valley, but is also happening across the Feeding America network as well. We're part at the state level of something called the Healthy Pantry Initiative, where we are encouraging our partners to provide people healthier foods and allow people to make choices with food. We're also doing some research connected with that. We are partnering with healthcare outlets across this region. So with hospitals like Einstein, CHOP, University of Pennsylvania, Jefferson, ensuring that as patients are released from hospitals, they have access to healthy food. Some of the produce distributions we're doing are in concert with those entities. In fact, at our last virtual town hall like this, we had a representative on from Einstein talking about that work. In this area, we also are partnering with other managed care organizations like Health Partners Plans, UPMC, Gateway, which is now Highmark. And as their members identify as food insecure, we're able to provide them either with free groceries or healthy meals prepared by our community kitchen. And so a key theme in this conference, I went to several sessions that talked about this, is how can we make it easier for those benefits that come through Medicaid and Medicare to cover the cost of healthier food for people who are food insecure. And then the last theme that I want to really uplift for our conversation is supporting research to really verify that these programs are working. We have expanded our capacity at Philabundance to really measure our impact. In the next few days, we'll be putting out what is called at Feeding America, the Feeding America Client Survey, where we're directly asking people who receive our food across our service area if it's a food they want, if it's in fact helping them, and we'll be able to use that information to really measure the quantitative and qualitative impact of our work. And so it was great to see support for this from at foundations who attended the conference, but also for government entities across the country. Similarly, this work is happening not just at Philabundance, but across the Commonwealth through our partners Feeding Pennsylvania. They've received a grant from the state government to help us measure impact for not just Philabundance, but all food banks and pantries across the Commonwealth of Pennsylvania. So I want to highlight just a couple of more programs that are related to the themes that we saw. With respect to healthcare costs, this concept of food as medicine is something that's kind of that we're seeing across the country. And so making sure that we are linking up what's happening with providers as well as with managed care organizations to support this work. Mobile markets are actually called out as something that's positive, particularly for supporting veterans. We have a couple of great mobile markets in our area that we're already supporting, the Chester County Food Bank, through the Bucks County Housing Group, and we're looking to have more. So this is a way to either through providing free or discounted food, but we're taking it to where people are. It's particularly important in those neighborhoods that don't have access to grocery stores and healthy food on a regular basis. Workforce development was called out. I'm actually sitting at this moment in 10th and Dauphin in Philadelphia at our Philabundance Community Kitchen, where we've operated a workforce development program for people who are SNAP eligible for 20 years. And so it was good to see that workforce development and ensuring that people have access to resources to feed themselves is critically important in this. And then finally, DoorDash, who is a new partner of ours here in the Philadelphia area, but across the state and now across the nation. DoorDash is actually distributing some of the meals that we're able to provide. So we have a government program we distribute called the Senior Food Box Program, and DoorDash is a partner in that. Public transit and accessing food is a challenge for many of the people that we serve. And so getting it to people was something that was also important. I think I may have one more slide. Is that my last one? Great. What I found was, and you'll hear, I think, more about this from Desiree and Barbie, I found the experience to be affirming and informative. To be in the space with, I think, 550, 600 other people who were so dedicated to this work and believing that we could, in fact, solve this problem was affirming. That said, there definitely are some challenges with the plan, and you won't be surprised that if you're working with a government or especially the national, the federal government, there were some things that we didn't see. And so this slide really outlines some of what the missed opportunities were. We would have liked to have seen more support around TFAP. The United States Department of Agriculture, USDA, did announce a $1.5 billion investment, some of which is for TFAP, but we'd like to see more to really make sure that the charitable food system that is going to be here, that has been here, has been on the front lines. Organizations like ours, like Murphy's Giving Market, like like Philabundance, like all of our partners, get the support that they need. There weren't direct supports for immigrant people. And one of the things we're able to provide because of the generosity of our donors is that we can often, outside of government food, provide food to anybody who comes up and asks for help and needs help. And so that there weren't specifics called out for people who were immigrants was a concern for ours. And then across the Commonwealth of Pennsylvania, we're seeing this other places, there have been efforts made to allow more people to take advantage of SNAP by expanding the percentage above the poverty level that people could be eligible. That said, we definitely know that there still is something called a benefits cliff. People can get to a point where they make too much money to be eligible for benefits, but clearly not enough money to live in this area. And areas like ours, particularly, I would say living in the Northeast, or particularly in the area of Chester County, where housing is expensive, transportation is expensive, and with the inflation we've seen, that really leaves out our neighbors. And so we would have liked to have seen more of this. When we get to the discussion, we'll talk more about that. I think that's my last slide. But again, I just want to thank everybody for participating, and it's great again to be there with Desiree and Barbie.
Great, thanks, Loree. Next, we will hear from Desiree Marr-Murphy. Desiree is a proud mother of 5. She is a special needs coordinator for the School District of Philadelphia. She is the founder of Murphy's Giving. She was born and raised in West Philadelphia, is the founder of Murphy's Giving Market in Upper Darby. Last year, she was elected to the Upper Darby School Board with all of her free time, and is also a member of the boards of a number of other organizations. Desiree, thanks so much for joining us. We'd love to hear from you about your experience at the conference.
Thanks. I'm so glad to be here. And of course, it was such an honor to be at the conference last week. I never even thought that I would even have that opportunity. So it was just so great to be there with Loree and Barbie and so many others who were like-minded. As Loree said, it was such a bipartisan event, and it was just so good to be there with people who, share the same vision of wanting to end hunger by 2030. Murphy's Giving Market started out just as a direct need to serve people during the pandemic. As we know, the pandemic opened all of our eyes up to the need to serve people, regardless of race, ethnicity, income, because the pandemic showed us that there's real systemic issues with hunger and poverty in America, regardless of what your background is. And I guess some of those things were brought up during the conference. So the one thing that I said that was brought up during the conference that I was not aware of is that the impact of the child tax credit. I know for me and for many people, within my income bracket, the child tax credit was huge for us, but I did not realize how that was, on a national level. It was said that was the single most impactful benefit for families around the country. And for me, that meant a lot, because I always thought that like food stamps for families or other benefits for families were a lot, but I guess for working families, or for those who file taxes, the tax credit was impactful. And even after I came home and I started asking families, so what do you think about the tax credit? What did you get back in the tax credit? And they said they were able to buy more food, they were able to pay off credit card debt, and they started listing all the things they were able to do with the tax credit. And they said, please continue to fight, like go to your legislators. And I told them to go to their legislators and fight for that tax credit, because if it meant that much for me and that much for working class people and people that are teachers and doctors, or nurses, should I say, then what does that mean for everyone else? Of course, universal access for children for free meals. The reason why all of this started for me was because I was a child in school who parents did have the income, but the income didn't always make it into the home. So I didn't qualify for free lunch. So we do need to make universal free lunch for every child that enters a school building, regardless of what the income is. And I know in Upper Darby, where our center is and where I work and I'm on the school board, that is something that we do. We have universal free lunch for all children and breakfast and snack now too. Like some kids get snacks. We actually go a little bit further than that. We work with Aramark, who we have taste tests for kids, because we know just not making free lunch available is enough, but make sure the kids like the lunch. So we did taste testings with the kids. And Upper Darby is in a location that's a melting pot. It's like a little mini New York. So we have over 94 different languages and dialects spoken in Upper Darby. So making sure that the lunches and the meals are culturally relevant is important. So making sure that kids are just not fed macaroni and cheese and pizza is very important. And that was one of the things that was brought up in the panels last week. So it was the discussions were very relevant to everything that we talk about in the work and the practice that we do, boots on the ground each week here in the county, in Delaware County, and in Philadelphia, where I also have sites. So many of the things that were addressed. And like Jose Andres said, prevention is better than remediation. It's so much easier to prevent some of these diseases than to try to remediate them later. And that's where I felt there was a little bit of lacking with the not addressing the homeless population, or not addressing the immigrant population. If we could provide more services to immigrants, or provide more services to the homeless population to be able to prevent some of the medical issues that plague them, then our economy will be so much less, because we'd be able to remediate some of the situations that they go through, the health issues that they have to suffer. In 2020, Loree and I had the prestigious honor of meeting then President-elect Biden at a Philabundance event where he was packing down at South Philly with us. And the one thing I charged him with is fighting for food insecurity, fighting for making food available for more families, and taking away some of the barriers that food pantries have to go through with TFAP. And he said, I promise I'm gonna work on that. So it was so good to see that some of this is coming to fruition, and he's really keeping to his promise, because a lot of times politicians, and I'm said to be one of them, make promises to get in office, and then once they get there, they kind of scale back on their promises, sometimes not intentionally. But it was good to see that he really, along with McGovern and a lot of the other politicians working for this, really standing true to what they believe, and trying to make sure that there's access for everyone for food, free, nutritious food. What I found interesting, it wasn't just food banks and food pantries there and people directly connected to food. We sat next to the Special Olympics. We sat next to other people. There was a dynamic speaker. Her name skips my mind, but she was a military vet, and she lost her legs in a car accident. And she just talked about how she does all of this work, working with military vets who have lost limbs and have mental health challenges now because they go through so much, but she just works with them and she trains them to get back up, and she works in nutrition and health with them. And it just was like a whole holistic approach, which Murphy's is really tied to, the whole holistic approach to poverty and nutrition and health. And for me, the conference was just so hopeful. The one thing I just want, and I pray that we don't lose that steam. Like, we don't say, oh, this was a great event, we learned so much. Where do we go from here? What happens next? Can we keep fighting? Can we make sure that these things really do happen? Because we lost so much. What we learn about recessions, or about what we learn about national issues that plague the country, like pandemics, is that people that are food insecure, or people that are already suffering poverty, it takes them 10 times the time to bounce back from something like that. So since we already know that, what can we do now to shorten that time frame so that people don't have to continually suffer longer than people who do have money, or who do not have to work as hard to come back from recessions? And the one thing I want to leave you all with is that it always baffled me, since we know that food is like health, is that when a baby is born, doctors initially put the baby right to the mother's breast to feed the baby because they want the baby to nurse, because they know that that's nutrition and they know the baby needs immediate nutrition. They'd have to nurse the baby. But then why do we not continue that in America? Why do we not continue to make sure that the babies and the children and families continue to have nutrition throughout the rest of their lives? It's like they start something and just don't stop. They just stop.
Thanks, Desiree. That's an excellent point, and it's a problem we all need to address together. Before doing some Q&A, I'd love to talk a little bit with Barbie. Barbie Izquierdo was born and raised in North Philadelphia. She is the founder of Community Driven Consulting LLC and the director of advocacy and neighborhood engagement at Feeding America. She is an Afro-Latina activist whose lived experience trailblazing in the movement to fight the exploitation and underrepresentation of people of color who have been affected by public policy and frankly the lack of public policy to address these populations. In 2002, she was awarded the Global Citizen Prize Award for her work demanding equity, being the first person in the history of the award representing the United States. Barbie's got some amazing experience with food insecurity, social justice, and a number of issues that impact people of color, underrepresented communities, and really all of us. So we're excited to have you here today, Barbie, and would love to hear your thoughts about the conference.
Thank you so much for having me. Thank you, Loree. I always love doing things with my community since I no longer live in Philadelphia, sadly. I miss you guys so much, but I'm so happy and grateful to be a part of this conversation. I went to the conference as someone with lived experience. That was my focal point. That was at least what my focus was. However, in my role, I was presented with the opportunity to help lead the navigation of people with lived experience who were sponsored by Feeding America to make it to the White House conference. So if we're talking about like some of the gaps and things we wished we would have saw, I think that it was a blessing to have Feeding America be able to sponsor people to get to the conference. But a lot of the processes to get people there were a little cloudy sometimes, with it being the White House last minute information. It was very difficult to manage that, and to also try my best to keep people with lived experience feeling comfortable throughout this conversation and this experience. So we did organize a dinner for everyone who was going to the conference to sort of get to know each other and feel comfortable before being placed in this setting where we didn't know who was going to be there. We imagined, senators, politicians, CEOs, corporations to be there. But sometimes going into those rooms can be very intimidating, especially if you're coming from a place where you are more impacted by hunger than physically attached to the work, or not as enveloped in the work as you would like. So yeah, I unfortunately did not get to sit in on the actual sessions. I was helping with some of the people who had mobility issues throughout the conference. But it did help to raise some awareness for me. I know that the White House put out their national strategy the day before the conference, and they did let that widely be known. But in my role with trying to get people to the conference, what I realized is that this strategy was a 40-page document, and that unfortunately many people who were traveling to get there at such a fast pace maybe would not have the opportunity to dissect a 40-page document to see, where are the places where people with lived experience, where their voices have been uplifted or their suggestions have been magnified. But I do love the fact that we were invited, and to see, so many people engaged in conversation with the USDA, with senators and things like that normally wouldn't be in their circle, was something that was very empowering. watching the neighbors use their voices to tell their stories and seeing how they impact so many different people on so many levels, not just, you know, on how they can do this work better, but on a personal basis, you know, realizing what can we do to help, or motivating others to join in on that help, is something that I absolutely love to see. And I think that some of the things that I heard from the neighbors were, like Loree mentioned, we're talking about the cliff effect, and wanting to strengthen the safety nets behind that, and having more supports for transition periods for families who, you know, sometimes are working 2 and 3 jobs and are still not making ends meet, or who, as Desiree explained, are already in poverty and are impacted by the pandemic, and all of a sudden have more limited resources than what they normally had access to. So yeah, I think that it was a very eye-opening experience. I love the opportunity to be amongst my peers. I would have been a little happier and love to see maybe some pinpoints in the national strategy of how all of the insight from the listening sessions that were held nationwide, not just by you know, Philabundance and Feeding America, but so many organizations across the country. I would have loved to see like how they specifically used our voice. Sorry, I accidentally muted myself. How they use the voices to come up with that strategic plan, and or how they plan to take the insight from the conference itself and move it forward. You know, they talked about, you know, what are your bold and innovative ideas to end hunger. And I think that we heard a lot of that in person, but I know that there were so many people who are interested in the conversation and, you know, weren't able to be there or weren't invited to be there. So to see more effectively how our voices could have been used is something that I would have loved to see. It was amazing to get to hear the president speak in person, and to hear the uplifting words of Chef Jose Andres. You know, some of the things that he said are the things that we live, you know, the things that we as hunger fighters know. But to hear it being shared with the world was so empowering, and kind of made my, I can only speak for myself, but it made me feel like, you know, people saw me, even though I wasn't the one on the stage. It made me feel like my concerns mattered, and they were being uplifted by someone who can get and point people in the right direction, and to reinforce that charity cannot do this alone, and that we do need the assistance of government and you know, the advocates to work together. Is something that's so important to us. And Feeding America has recently released a report on elevating voices, which talked about centering people with lived experience and the importance of having the people impacted by hunger involved in the work and advocating for themselves. So I would have loved to see some of that incorporated into the White House conference, because I know that personally I've been sharing the past 14 years of my life to work towards ending hunger. For me, that took being in a film in A Place at the Table, and people got to see the conditions of the home that I was living in, the food that I can afford to provide to my children. And it's something that still brings me shame. Even, you know, the film came out in 2012, and I still deal with some of that. And I think that the forward-facing thing that I can do is use my story to help contribute to the solutions that we need to eradicate hunger. And I hope that, you know, the world can see that that's what we're trying to do. The storytellers, the people with lived experience, we're taking a pain that we have, and something that has moved us so much that it's more than us. If we wanted to just change our story or change our circumstances, we can do that. But no, like people like Desiree create something so that others, other neighbors, other families won't be as impacted as we have been, so that we can stop the stigmas and stop the judgment, and actually get people the accessibility, the affordability, and the nutritious and healthy food that we all need.
Thanks, Barbie. You know, your willingness to share your story, you know, I don't think can understate how much good that really does for the cause and for people, you know, with similar experiences, and the courage that that takes is really admirable. So we really thank you for that. Would love to open it up. Just one housekeeping matter, you know, we've got the chat for Q&A. So if anyone in the audience has a question, please throw it in the chat and we will try to get to it. But I'd love to hear, you know, talking about how you felt, you know, you felt like your thoughts were heard, how you felt there were people there that wasn't just the president, it was senior level folks. So I guess the real question is what, you know, what really is next? How do you take the energy from this? How do you take the thoughts were there? How do you take hopefully the empathy that was in the room and translate it into real actions? Would love to hear your thoughts on that and your thoughts as well, Desiree.
Yeah, I would say, you know, to keep doing the work. The conference was an opportunity for all of us to come together and to sort of build those bridges of how we can all use the avenues of health, nutrition, and hunger and work together to sort of eradicate all of that. So we're, you know, at Feeding America and myself as a hunger fighter, we're going to do what we always do. We're going to continue to organize. We're going to continue to mobilize. We're going to continue to uplift the policies that we know are helping our communities, and calling out and working on some of the ones that don't, and addressing the gaps and the barriers that so many communities face in America. But that also takes letting people know, you know, reaching out to your city council person, your congressman, your state representative, and letting them know that, you know, SNAP is an important program. It's working. It may need some tweaks, but it's something that's vital for the livelihood, the survival of so many families in this country. You know, we have to stay on top of the Farm Bill, the Child Reauthorization Act, the TFAP, all of these programs that we know are contributing to the meals that we're eating every day, that our children are eating every day, that you know, it is a direct reflection of who is going to lead our country in the future, right? If we're not taking care of our kids now, you know, they're only going to continue to be malnourished, and it's going to affect, you know, their cognitive skills, their intellectual abilities. I know that when I went to school, I got free and reduced lunch, and when I didn't, I wasn't focused on my schoolwork. I was focused on when snack time, or when am I going to be able to eat something. So just reminding people that, you know, let the solutions come from the people who have been impacted by hunger, or at least we don't know everything, right? And we can admit that, but at least have us involved, and not involved when you need a story. Have us involved in the blueprint. When you guys are coming up with the ideas on how to eradicate hunger, involve us then. Have us involved in the analysis portion. Once you have drawn out the ideas and, you know, you want to go through and figure out what works and what doesn't work, have us help with that. In the execution, like, hire people with lived experience, have them working on these issues, because it also motivates community members that are living in poverty to know that they can escape it and have their this greater sense of purpose that for me has absolutely changed my life. I'll end it there because I can keep going.
No, Barbie, you're absolutely right. And I had the same conversation with, you know, some mayors and some state reps, like soon after the pandemic, when they were giving out those boxes, like the city boxes, like, stop trying to develop your own programs. Just give us the money, give us the funds, and just give us the freedom and flexibility to do what we've been doing for decades, and let us do it our way, because we know what we're doing. We're the professionals. We've been doing it for a long time. We know how to listen to the voice of the people and to give them what they need. It's time to stop packing boxes and stop thinking that we all have the solution, that everybody is this is a one way. It's an individualized system where we need to support people and meet people where they are, ask people what they need, and stop just assuming that everybody is the same. I was going to say one thing that came out for me, or one of the things that, you know, really touched me when I came home yesterday. Well, during the conference, I did a story with NPR. They interviewed me, and I talked a lot about my experience during the conference. And yesterday I came home to a letter from a lady, I forget her name, but she lives in California. And she said that her husband was from Philadelphia, and he had moved to California, and they were married for 43 years, and he worked for Walt Disney. And she just was so touched by the work that we do in food insecurity. And she just wanted to bless us with a check, a small donation. And she knows how hard this work is. And I think that was the most impactful thing about going to the conference, is because we were able to talk to people who really know this work is very hard. It's not about just passing out a box or passing out food. It's about listening and taking the time to hear people's hearts and their stories. Some people want to share, some people don't. But when people are there and they want to share and they want to talk to you, you have to be there to listen, because like Loree always says, but for the grace of God, this could be any one of us. And for many of us, it has been. So we know these people's stories, we know because it's been us.
Right. So let me ask this, and I'm going to sort of ask a two-part question. One part based on a question we have in the chat here. You know, we know politicians have been, as you said, loading boxes for a long time. What, if anything, makes you think it may be different this time? And the second part of that question is, you know, given everything that is done with data now, everything is measured, right? You know, how can we, you know, do we think, you know, this attention may lead to sort of a system where we really measure impact in a better way, which helps, you know, direct resources in a better way?
Well, I can start. I think the publicity that we've all gotten since the pandemic, like we've all been getting lots of news. Media wants to come out and talk to us, and we see them. And there's a bigger push from Feeding America, from Philabundance, from Share, from all the different resources saying, hey, we want you to start doing things a different way, letting people have choice and a voice, because I think there is this nuance that, hey, maybe this isn't working. Like maybe people are really wasting this stuff, and they are. They don't want to eat food that they don't want to eat. Prime example, like we get those produce boxes, and sometimes there's like a ton of sweet potatoes. Everybody doesn't know what sweet potatoes are and what to eat them, and they go in the dumpsters, and we have to be the voice for what we want, and people are listening. So I think that's a big part of it, is just changing what we've been doing, because if you keep doing what you've been doing, you're going to get what you always got. And I think that's, you know, we're being those advocates and those voices. And I think that's a big part of the conference. Is it was great to be in the room, not just as people with lived experience, but people that are out there like doing the work to say, hey, this is not working, you have to change. And just constantly beating it into people's brains that this is not working. Look at the data. Look at the data from the poundage that's coming in, the poundage that we're ordering or not ordering, what's sitting on shelves, because we're not going to order that because people aren't taking it. So stop buying it.
And I would say, I think that with what has happened in with the conference, it has definitely showed us that change is coming. You know, this conference, the first one that happened before that was 50 years ago. So to see that huge gap and for something to happen in 2022, this means that we are all a part of history. It means that all of the work that we have been doing, you know, has led us to this moment. So I definitely think that it shows change, or at least a desire for change, and also an acknowledgement of all the hard work that everyone has been putting into to eradicate hunger. I remember back when Obama was our president, and he was trying to work on ending hunger. So this is something that, you know, has gone under the radar, but definitely has been addressed or has been worked on throughout all of these years. So I'm hopeful that you know, shedding light on the conference can definitely bring about change. We know that, you know, the WIC program and the SNAP program both stemmed from the first hunger conference that happened 50 years ago. So I'm hopeful that maybe, you know, with these bold and innovative ideas that the White House has collected nationwide, that maybe there can be some new programs implemented that we haven't seen before. And regarding the data question, I think that when people think about data, a lot of it is just the numbers. And I think that talking about the discussions that have happened regarding the pillars and how poverty reduction or poverty is a root cause of hunger has definitely shown us that there's way more in this data than the numbers of people who are impacted, right? We can learn how are they being impacted? What is this doing, to their mental health? What are the social determinants of health that people are dealing with that are keeping them in poverty or affecting their food insecurity? So I'm hopeful, and I'm hopeful that more people with lived experience that are researchers and data analysts come forward, because at least they would see that in this space, maybe an avenue that they have not thought about before, that they're needed, that they're welcomed, and that, they can help us disseminate all of this information that needs to be spread out nationwide to build the legitimacy of the work that we're doing, but to also, continue growing this movement and have more people involved. Because when you see that it's happening in your community, it makes people feel like it can happen to them.
Yeah. So let me ask this question, and I know both of you have seen the plan that came out of the conference, but if cost wasn't an issue and you were president for a day or maybe longer, what would be the one thing you would immediately focus on that the federal government can do that they're not doing now? And again, cost is not an issue.
Take it first, Desiree. You want me to go first?
Only one thing?
Only one thing. Not to say you can't have more later, but this is the first round. We only have till 1:30.
I mean, I would have to say that I would have to say the child tax credit, because I think for many families, the thing that I'm hearing is that the child tax credit was huge for families, especially working families who don't qualify for a lot of benefits. I would say that the child tax credit was huge. And if we can extend the child tax credit and constantly move people, give people that extra money each month that they need to move to make those ends meet, especially with the inflation of rent. Like, there is affordable housing is no longer a thing in some areas. So if we can make that, if we could keep the child tax credit, maybe even increase it, and make that child tax credit available for all families, or for most families that qualify forever, I think that was the biggest thing for me throughout the conference.
There's a lot of things that I would change, but I think that what sits in my heart the deepest would be to address the cliff effect. I remember many times that I was working, like at one point I had 3 jobs, and it was affecting how I can qualify for benefits, but I also was still not able to make ends meet on my own. So thinking about what that did to my mental health, how it made me feel as a mother, how it made me feel ineffective as a person who was working in the anti-hunger space and still facing food insecurity. I think that it would help, the soul of the nation if we really understood that coming out of poverty is something that doesn't have a deadline. Even when you're not physically there, mentally, you have to teach yourself how to no longer live in survival mode. And that's something that I'm still learning. There's no deadline on how to get rid of those feelings. So if we had a better way to support families that are trying to get off of the programs that keep them in poverty and also stigmatize us with these labels of like welfare queen and all of these other things, then maybe we would see the true potential of people who come from low-income neighborhoods. When you're working 3 jobs and still don't make ends meet, and you're trying to get assistance from these programs and they're not helping in the ways that you feel they should, or that you see is not showing up on your plate at home, you begin to resent the government. You begin to resent the programs, because it feels like you're doing everything you can to ask for assistance, which can be very degrading. It can be very shameful. It can be, hard. There's even so many things culturally that people face when even just asking for assistance. So if we can build a safety net that helped people transition from getting out of poverty to heading towards financial stability, or going towards, living a comfortable lifestyle, then why not do so? Why are we penalizing families by taking away vital benefits just because they're making a little bit more money? And just as a second thing, really quickly, I would change how the processes of applying for benefits and what is counted when you write in your applications, you know, your income and all of your expenses. Like, why are we not including dollar for dollar every expense that families are facing? They're showing you all the bills that they're paying and they can't even get credit for them, but it's counted against them in their eligibility. And I just think that there's so many thousands, millions of families that can qualify for these programs if we tweak the federal poverty level and we took under account inflation and you know, cost of living constantly going up, a minimum wage staying in the same place, then so many families will be able to get the food that they need in a dignified way without judgment. And it'll, again, not just help the nourishment of our families, but the nourishment for our mind, our bodies, and our souls, because we're no longer feeling that sense of all things gloomy that come with poverty.
And I know we gotta go, but I gotta pick it back on what you said too. And that's absolutely right. That was one of the things that we talked about in the breakout session is why isn't there like a one app? Why is there not a universal application for all these government benefits? Like for WIC, for SNAP, for Medicaid, why is there not one universal app? Because and the government gets when you file your taxes, they know what you make, they know where you live. Like, why is it so hard for people to just apply for the benefits that they need to apply for? Why do they make it so difficult? And just like you said, I had a family come to me recently and they said, you know, they asked the politician, they said, why can't they raise the minimum wage? And the answer was, because if we raise the minimum wage, you won't be able to qualify for benefits. And I thought that was the craziest response. We got to change the systems in America.
Yeah, so that leads to my last question. You know, obviously this was a great event, very high level, high minded, a lot of publicity, and you guys are on the ground fighting the fight on a daily basis in a very granular way, right? And the solutions are very granular in a lot of these cases. You know, how do the people listening on this call or anyone out there, whether they're experiencing hunger or not, how do they help, you know, combine the two, the attention, the publicity, the energy from, you know, a very high level of the federal government to what we really need, which are granular solutions? How can we help?
I would say that we can start by, you know, reflecting the question or posing the question back to the people who are already in power, the organizations that can employ people with lived experience, the politicians who are making the decisions for us. Like, you know that we exist, because it's hard to miss us. We talk a lot, and when we show up unapologetically. We're here and we want to be used. Use us. You know, like I said, we might not have all of the solutions, but we can help fill in the gaps. We can tell you what's wrong. We can tell you what our ideas are and what works for our specific communities, which can be very different. Like, just moving from Philadelphia to Florida, the needs here are very different than living in a suburban city. I mean, in an urban city. So, you know, I would definitely say create more opportunities for people like us to get involved. To the corporations, to the politicians, to people who run organizations. But for people like myself, people with lived experience, I would, you know, I have to speak to them if there's anyone on this call and reassure them that you have a worth that goes far beyond your experiences. And being in this work of telling your story can be very triggering and re-traumatizing. But the strength that you gain as a person after standing in front of a crowd and saying, yes, this is my story, but this is what I'm doing about it. Because again, it's not like we're just creating a solution for ourselves. We're searching for solutions for our communities. We want to get involved in the greater change so that no one has to feel the things that we have felt. So for people to acknowledge that and give us our place in these rooms where we're usually not in and where decisions are being made for us, versus having people who are impacted by the decisions being the ones making the decisions or influencing the decisions. I would encourage people with lived experience, you know, our neighbors, to join this fight and join this movement. And if you need help, find us. I work for Feeding America. Look for me. I will definitely work with people on how to tell their stories, how to get involved in their own community, how to battle that constant pull of like, do I let people into my life and tell them these things that are so, have been so harmful to my mental health to create a solution? I can tell you what it feels like to be on the other side. And I've been doing this for 14 years now. There's nothing that's going to stop me from telling my story. Like, even if I don't go into specifics, because as a challenge, I also had to learn that telling people the hardest things that I've gone through in my life doesn't necessarily mean that that's the only thing that's going to get me in the door. You guys already know my story. So when I'm in the door, I'm going to talk about the solutions, because I won't let anyone box me in as just a storyteller. So people with lived experience, y'all not just storytellers. We need you, and we definitely want to support you. Please come and join us.
And I would just say accountability, holding people accountable, going to those township meetings, going to any level meeting, and just holding people accountable. When you see something wrong, say something. Holding everyone accountable to make sure that people are doing the right thing by people.
No, that's really important. Well, Barbie, you talk about being in the room, and I know certainly yourself, Desiree, and Loree, there's nobody better to be in that room at that conference than the three of you. Your advocacy is amazing and inspiring, and we need you, and we need you to continue to keep helping keep everyone accountable and figure out how we help you do that, because it's you can't underestimate the issue. But we really appreciate your time. If anyone wants to follow up, this is an ongoing conversation, and I know we're all going to follow up and see what's coming out of this conference and how can we help continue to advance the ball. But otherwise, we really appreciate everyone's time. Any more information, you can go to our website, philabundance.org. And on that note, I'll wish everyone a happy weekend and stay healthy. And again, the Phillies are big supporters of Philabundance. So let's go Phils, and hope everyone gets a good time to rest and relax over the weekend. Thank you.
Bye, everyone.